Hi, I'm Maddie,
And I'm Teresa.
and today we're going to be going over case study 3, which was low back pain. So, first, our main issues basically we're presented with a new class for 3 sessions of 12 weeks and duration of 60 minutes. Basically, we're given 12 participants, and the main issue of this is low back pain, which we're trying to combat. Uh, Basically, one of our other issues is that we have people of all different fitness levels, so we have to find ways to progress and regress in our exercise prescription. Next, we have our precautions and contraindications. First one would be our proper lifting form. This source right here kind of explains that the proper lifting form is essential in making sure that you don't injure your back even further, which could cause low back pain. Next, we have posture. Posture, especially seating in a slouched position, is one of the most negative things that you can do for your low back. So, this source kind of goes over people that work in offices that 9 to 5 that kind of sit all day, and it shows exercises that they use to drastically help improve their low back pain. Next, avoid heavy lifting. Avoiding heavy lifting is really important because when you heavy lift, you're more likely to lose your proper lifting form that I talked about before. And then lastly, a contraindication would be placing stress on that spinal cord. Like the picture in the bottom right, placing the stress really hurts. And avoiding exercises like leg lifts are really essential.
So our focus for this workout is going to be to reduce spinal compression, like Maddie said. It just reduces the stress that is present in the lower back. We're going to also strengthen the anterior and posterior chain. We decided to do both the posterior and anterior chain because it's been shown that the posterior chain and strengthening that actually helps reduce low back pain. And since we're going to be strengthening the back, we also have to strengthen the front to limit the imbalances throughout the body. We're also going to work on core stability and balance in our participants as well. So this is going to be our sample exercise prescription for them. We came up with 6 different movements and 2 progressions for each movement. So for the first one, it's the bird dog. And our first progression, if they don't feel comfortable doing it, would be the bird dog, but having the knee touch the floor each time. And if they are able to do the regular bird dog, then we decided on a banded bird dog. This is important because there is no spinal compression in the lower back, and it does improve balance and core stability. Our second one is going to be the dead bug. There are modifications to it and progressions that we would implement in order to allow the 12 participants to get the best exercise from each session. It also prevents spinal compression, improves core stability, and it works on anterior chain development. Good mornings or back extensions, whichever you prefer to call it, also prevents spinal compression, works on core stability, strengthens the back extensors, and also aids in posterior chain development. Glute bridges strengthen the lumbar region and the back, and it works on stable core. Pal-off rotation also improves core stability, works on posterior chain development and anterior chain development, as well as balance in one of the progressions. We do have them sitting on a stability ball if they are comfortable enough and working on their balance while using that resistance movement. And then the final one is going to be planks, which aids in core stability and balance as well. We do have several modifications that each participant can utilize if they feel comfortable in performing them.
So next, we're going to kind of talk through our incentives that were brought up. So first, the registration incentives. Basically, what we're going to do is we're going to advertise this as all of the exercises that we use in our program are proven to help low back pain through research. This is really important because it'll just kind of show people that what we're doing is actually scientifically proven and it's not just something we're trying to throw together. Also, we're going to do purchasing bundles. So if they purchase all of the classes, they're going to get a little bundle or a discount. And that's really going to incentivize people to buy the entire class and even go to the classes since they've already purchased them. Next, the course completion. We're going to incentivize with free gear because who doesn't like free gear? And also, we're going to, like I said, it's proven to improve pain over time. So I think that's a really good incentive that we need to keep instilling in our patients so that they're going to want to complete the course.
And these are our references.